Hi, I'm Dr. Rob Lindsay, and in this video today I'm going to talk about what is functional medicine. People hear this buzzword, functional medicine, they don't really understand it, and I just want to take a few minutes here and hopefully we can explain this to you. Here's the deal. When you think about medicine, you think about traditional allopathic Western medicine, and that is a disease care, symptom-based approach to healthcare. You as a patient have a symptom, you go to the doctor looks at your symptom, looks at your history, maybe runs some blood work. Based on those things, then they're going to go to a manual for the most part and to their clinical experience, and they're going to try to find a medication that goes with treatment of that particular symptom or disease process. That's the medical model that we have been really known and brought up with throughout your life, my life. But what's happening now is that people are recognizing and realizing that in order to be healthy, we cannot just focus on symptoms. As a matter of fact, focusing on symptoms does not actually increase health. And there's never ever been a drug that is shown to give the body a nutrient that is required for health and healing. If you can find one, great, but there aren't any. So instead, functional medicine is a paradigm shift. It's a way of thinking, and it looks at getting to the root, getting to the cause, getting to the underlying reasons why a person has that symptom, and not just stopping there, but trying to actually restore health to that body. And that body, your body, is more than just your symptoms, and it's more than just a physical thing, because you have emotions, and you have your physical part, you have a spiritual part. So in functional medicine, we have to look at all of those things. And if you are a person who, for example, has a disease diagnosis called fibromyalgia, well, you're kind of known as a fibromyalgia patient. But in functional medicine, what we would say is, no. You are a person, a patient, a living human, someone who has thoughts, who has feelings, who has emotions, who hurts, who has a set of symptoms, and we need to try to find out what's causing it. That's the difference. So, in functional medicine, we want to look at you as a whole person. I want you to remember that. Number two, we can't just focus on the symptoms. So I want to take an example using the whiteboard here, and let's just imagine that the whole whiteboard is you. This is your life, okay? Now, you happen to have a set of symptoms, and we're going to draw that right in the middle here, and this is your set of symptoms, and I'm just going to write that, symptoms. Now, I don't care what you name the disease, I don't care what kind of symptoms you have, what you really have is what we call a web of dysfunction. So in functional medicine, we have to go in and try to find out, well, which organs are not working the way they are supposed to. They're dysfunctional. It could include looking at the brain. How many of your doctors, when you've gone in with a set of symptoms, have checked your brain to find out if that might be a part of the problem? I would think that would be very important because the brain runs the body. How about this? How about the colon? All right? Well, your digestive system is critically important for your overall health. But if we don't look at your colon, how can we get you well no matter what your symptoms are? Let's link these together. Let's look at the stomach. Let's look at the small intestine. Okay? All of these different organ systems are linked together. Matter of fact, this one right here, we're going to call the gut. If you have poor gut health, then you'll have poor brain health. And that was going to affect your symptom, no matter what it is. So in functional medicine, we can't just look at your symptoms. Again, we've got to look at you as a whole person. We need to look at other factors. We need to look at how your genetics is influencing this. We know you're not a slave to your genes because genes can be turned on or turned off, but that happens based on your environment. So let's just say that you have a bunch of toxins in your life. Okay, toxin exposure. Right? We're going to link these things all together. Toxins can be affected by genetics and vice versa. Toxins will affect your symptoms. What if your thyroid is malfunctioning? Well, in this case, you don't just have a thyroid problem, but you have a health problem. So, once again, just to wrap this up, hopefully make this sense. This makes sense. We have to look at you as a whole person. We have to do a thorough history and examination. Functional medicine would do that. We would actually start to look at blood chemistry labs. We would look at how your body is responding to the energy systems around you. We would do applied kinesiology muscle testing to try to find root causes and organ dysfunction. When we have all the information, then in functional medicine, we can come before you intelligently and say, hey, we found the root, we found the problem, here's what we're going to do to correct it naturally, without drugs, without surgery. I hope that makes some sense to you. I hope that you will take this into consideration for your healthcare needs and the people that you love. This is absolutely the future of healthcare. Thanks for listening and have a wonderful day.